for women in these countries. Little bit more statistics around the BRICS countries is the fact that while I said 44% global GDP and half the world's population, some of the other aspects around BRICS countries is that BRICS Healthcare's meeting this year put in healthcare as one of the key agenda items, which again makes it mandatory for the BRICS economies to really look at health from a very different dimension. While infectious diseases strain our healthcare system, it is really the non communicable diseases where the burden continues to grow. And it's extremely important for us to be able to put our heads together to see how this problem can be solved at a global level. Talking of India, NCDs today contribute to about 51% of the overall disability adjusted life years. And what is alarming here is this is up from 31% to 51% in only about 20 years. So it's almost gone up by 20 percentage points. In addition to that, contribution of NCDs to death has increased significantly during this time from 38% to 49%. 51% of cancers occur in women. What we've seen is only 45% of hospital visits in India today are done by women, actually. And if you reduce further the OBGYN cases, then the gap significantly reduces them. And we also know that there are huge amounts of systemic factors as per the diagnosis of cancer among women. We've also seen that only 12% of Indian women in age 15 to 49 have any form of autonomy over their healthcare decisions. So all these are huge gaps that we see in the way NCDs are done. Now, while we do have all of these gaps and the picture seems gloomy today, what I would also like to highlight is some of the issues which have been taken very significantly by the government today, and we are taking strides in the direction of improving the healthcare approach to this incident. So one of the key initiatives from the government is the national key initiatives when it comes to cervical cancer, breast cancer, and the oral cancer. So that's one significant area where we're taking contracts to improve it. The second area is the increased focus to drive the HPV vaccination amongst girls. While there is a larger level awareness around it today, we need to increase the intensity, perhaps having that. And in India, we are not yet as well as the polio or COVID in recent times, we've shown a lot of success as far as programs are concerned. And therefore, FPV could be the next major drive which government can manage. Another key area for us is digital health initiatives, right? Helping us significantly support the decentralized delivery of NCD services using telemedicine, AI diagnostics, etc. So digital health is again another major initiative. Apart from that, I think I would like to talk about initiative which Vicky took about 2 years back, set up a task force, essentially in the space of cancer care. It was a multi-stakeholder group which had representation of policymakers, cancer care providers, senior clinicians, medtech organizations, and of course, our partners. As a result of the entire effort by the task force, we came out with a white paper, a roadmap for making cancer care affordable and accessible in India. This white paper was subsequently utilized to have interaction with all the government stakeholders and how to drive overall change as to management of cancer in the country. Subsequent to the release of the white paper, we also had 5 regional roundtables. Essentially, the focus was to understand what is the disease burden, in these specific parts of the country, and what are the specific dynamics there, and how we can utilize the findings of the white paper to really help them take next steps in the direction of the people out there. So we basically
Covered as part of these regional roundtables, different parts of the country were covered, northeast, west, south, as well as the northeast. In addition to that, FICCI, as part of their primary healthcare initiatives, is also driving a lot of screening initiatives for breast, cervical, as well as head and neck cancer. And more than 10,000 screenings have been done until now. In addition to that, I represent Siemens Healthcare. So Siemens Healthineers today is also involved in driving a lot of these initiatives where we can enhance the screening initiative by the government and also train the stakeholders in these particular areas to be able to do screening better. So we have great examples of programs being run in Odisha and another one being run in Karnataka in partnership with government of Karnataka. So that was about, what are the initiatives that we are doing right now. And essentially, this highlights where we are in terms of the overall disease burden and, what are some of the steps being taken today. So while the steps being taken today are well identified, I think what we need is a significant more impetus in terms of implementing this, because if we are able to better screen patients, whether it's diabetes, it's cardiovascular diseases, or it's oncology, we will be able to demonstrate significantly better outcome for these diseases. To conclude, I would like to say achieving sustainable development goals requires placing women at the center of health transformation. That to us is going to be extremely important. And I would like to conclude by quoting Honorable Prime Minister Narendra Modi, who noted at the G20 conference on women empowerment, when women prosper, the world prospers. Their economic empowerment fuels growth. Their access to education drives global progress. Their leadership fosters inclusivity, and their voices inspire positive change. I look forward to our distinguished panelists to share their insights from across the world so that eventually we can look at how we can collectively drive improved policies across the world and drive better collaboration in the area of NCDs. Thank you.
Thank you. Thank you, Ms. Malti, for the brilliant introduction. Maybe just a couple of more facts to supplement the entire context around the increasing burden of NCDs and how this entire platform can make a significant impact in bringing the BRICS nations together. So I think in one of the earlier sessions today, it was clearly mentioned that NCDs are today becoming a global pandemic. And what we are also seeing is that gender variations and disparities are playing out quite strongly if we look at the data in a very granular manner. NCDs today, we talked about the BRICS countries representing a significant share of the population and also the GDP. But it's important to note that almost 22 million deaths are happening in the BRICS nations as per data from WHO in 2021. And this is a 1.5 times increase in the mortality related to NCDs since 2000. It is also very important to note that the contribution of women towards NCD related mortality has reached 48%. And this growth in deaths is surpassing that of men between the last 2 decades. Specifically, when we come to India, what we wanted to set as a context was while we've talked about the NCD burden and mortality, what does it really mean in terms of impact economically or financially to the economies? Specifically, I think we talked about the fact that NCD burden from a disease profile perspective has increased from 45% in 2001 to 60% in 2021 in India. And what is worsening is that India today accounts for almost one-fifth of the global mortality in terms of cardiovascular diseases and one-tenth of the global mortality in terms of onco-related deaths. Also, a striking feature of India's NCD burden is the younger age of onset compared to global benchmarks. And some diseases that typically manifest in the later middle age or old age in high income settings are almost seen 3 to 5 years earlier in the Indian population. With aging of population and increasing burden of NCD, what we are also seeing combined with delayed detection is the increasing prevalence of comorbidity. And comorbidity is known to result in almost 2 to 3 times higher hospitalization rates, as is evidenced from global data. All of this means that if it is not controlled and managed right from the grassroots level, there is going to be a significant impact when it comes to healthcare and expenditure, specifically because of the increased hospitalizations and therefore the increased number of beds which will be required to service this demand. We talked about a lot of interventions which are happening at the government level, whether it is the NPC, DCS program, or it is even the Ayushman Bharat program, which is supporting accessibility through financing mode. There is also a lot which is happening from the private sector in terms of contribution towards, I would say, specifically prevention as well as early detection. Today, specifically, we see India pioneering digital interventions with a lot of frugal innovation which is happening. We've heard about the Nirmay AI, we've heard about Cure AI, we've heard about Zilico. All of them have come up with a significant amount of frugal innovation which can help improve the penetration of screening for cancers, whether it is the lung cancers or it is breast cancers or it is cervical cancers. There are also similar such initiatives which are there in the diabetes space where mobile telephony is being used to create awareness and follow-ups with patients to improve and change their healthcare seeking behavior. Having said this context, I would like to gradually now start having the panelists talk about various initiatives which are working in their countries. We'll start with Ms. Elisa Kowalski, co-leader BRICS WBA Healthcare Working Group Brazil chapter. I think, ma'am, before I come to your specific question, we've talked about cardiovascular diseases, oncology, diabetes, but what is also becoming a serious burden is mental health related illnesses, which represents almost 10 to 15% of DALIs in BRICS nations today. And it is also interesting to note that in countries like Brazil, India, Indonesia, and Iran, the share of women contributing to mental health related DALIs is higher than men, almost 55%. So, two key questions to you, Pam. One is the first part of the question is how can international collaborations within the BRICS WBA accelerate innovation and access in healthcare specifically for women? And the second part is how can initiatives like the Healthy Workplaces BRICS program strengthen corporate mental health and improve productivity amongst BRIC countries? Over to you, ma'am, for your responses.
Okay, thank you, everybody. And it's morning time in Brazil, so good morning and good afternoon for everyone. It's a pleasure for me to be here in this date sharing about Brazilian initiatives in mental disorders and cervical cancer, and also in other health challenges that all the BRICS countries have to handle at this time. So I think that BRICS WBA represents a unique platform to bridge innovation, equity, and impact across very different healthcare systems. And it's a pleasure for me to share a few reflections on each of these key topics. So about the first questions that you asked me about, it was about mental health. So in Brazil, we have already some big initiatives between entrepreneur, and we think that a public policy between the companies will be a very special initiative because we can handle about anxiety and depression, which are increasing in our countries, especially after the pandemic period. And when we talk about corporate solutions, when we handle this kind of problem with a lot of programs that can be shared, that can be translated, that can be that can keep when we can build KPIs that can be shared with other countries and also about other companies as well. So women in Brazil, we have a challenge that we have to handle a lot of problems between balancing the private companies and our professional lives and our personal lives as well. So when we have to enhance public policies between anxiety and depressions, we have a lot of KPIs that have already been implemented in a lot of companies. And we have also a ranking between them in which the best practices can be shared all over the countries. And also we can share for the other big BRICS country because we believe that the challenges, the problems can be the same. So the solution can also be the same as well. So it was my first answer to your first questions. When we talk about cancer, as we talked in the beginning of the section, we have in Brazil a very great initiative, which we call the HPV vaccination all over the country. And we started a project pilot in the northeast of Brazil, in a remote area where the access of health systems are difficult, and also they enhance a lot of problems between money and between the access to buy the vaccine. So we have an initiative called HPV vaccination here in Brazil, which is handled by a big group of women entrepreneurs, which is called Mulheres do Brasil, Women's of Brazil group. And they started doing a lot of vaccination between teenagers until 35, 38 years old, also for boys and also for girls and also for women in order to reduce the incidence of cancer, especially the female cancers, just breast cancer or the cervical cancer as well. And it has been a very great initiative because we are having a lot of great results by this practice. So it's a kind of policy, of public policy, that we can share with all the countries and have great solutions in order to reduce this kind of incidents, and also to share how can we handle with these difficult areas that we can't access, that we can't handle, that when we can't go across the countries, and to tackle this kind of problems and have great solutions that we can share with all the countries as well.
Thank you. Thank you, Ms. Elisa. We'll now move on to Professor Oksana Drabkina, Director, National Medical Research Center for Therapy and Preventive Medicine and Chief Specialist in Therapy and General Medical Practice, Ministry of Health of the Russian Federation, Russia chapter. Ma'am, before we come to the questions for you, NCDs remain the primary cause of mortality and disability in Russia, accounting for nearly 50 million DALIs and 1.6 million deaths in 2021. Almost half of all the DALIs and deaths are among women associated with NCDs. While men face premature mortality rates, more than 10 years higher, mainly due to preventable behavioral risk factors. And there have been a lot of initiatives taken up by the Russian Ministry of Health, including the national project Active and Long Life, which focuses on healthy longevity. There is intersectoral collaboration, which plays a central role in this agenda. And also, Russia actively promotes corporate health programs. So given this context and this backdrop, wanted to ask you, ma'am, what approaches and tools are implemented specifically under this national project of Russia, Active and Long Life, and how could some of this be shared within the BRICS framework with the other BRICS nations? Professor? Professor Oksana, you're on mute. Professor, are you able to hear us? You're on mute. We are unable to hear you. Well, maybe we'll come back to Professor in a bit. We'll then move on to Ms. Maika Nuryati, Indonesian Women Entrepreneurs Association, Head of Permanent Committee for Disease Prevention and Control of Indonesian Chamber of Commerce and Industry, Harsan Laboratories, researcher Health and Environment at School of Environment, University of Indonesia. Ma'am, again, specifically, we do understand that in Indonesia, mortality due to diseases such as cancers, diabetes, cardiovascular diseases, and also neurological disorders have increased almost 1.5 to 2 times in the last 2 decades. In this context, some of the key questions which we had for you was it is critical to provide healthcare access at the last mile, almost at the community level, to create an impact, specifically for NCD related care. So, what are some of these interventions which can be driven at the last mile community level, which can have a meaningful impact? And any success stories or case studies which you have to share around that?
Yeah, thank you. In Indonesia, I'm from IWAPI. IWAPI is the oldest and the biggest woman entrepreneur organization. So we have a lot of experience to in the grassroots level to find the missing people in hypertension and diabetes. In Indonesia, we face the unique challenges. Please help me to in the slide. I will slide the next. Yes. In Indonesia, many people in the rural area cannot access the uh, health facility because there is a traditional healer, said like dukun in Indonesia, and then most of the rural area didn't have the facility of health. So woman empowerment and connect and sorry and connecting with the organization, it's most very very crucial. So in my opinion, I have a key term like the last mile, simple tech, community network, and unserved area. Last mile means the hardest to reach group people in remote. And then how to reach them, we must use the simple technology. I think artificial intelligence is become the opportunities and the and the solution for this. And then we optimize the community network and to reach the service unserved area. UAP have sorry UAP lead about 15 NCDs monitoring hubs. We have the more than 3,000 community hubs to educate women about hypertension and diabetes. And we can we detected over 3,000 previously undiagnosed hypertension case in just in 18 months. And the missing person, those 1 in 4 until 5 people who didn't know they had NCDs, we finally found and we treatment them until going better. This is our achievement in the health issues. So your your first question is sorry. Why women drive success? I think because women are naturally health champion in families and communities. Uh, Indonesia, women run about 19%, 98% of our micro and small enterprises, and they understand community needs and business sustainability. This is for the first question.
Sure, sure. I think we have, thank you, Ms. Maika, for those responses. We now have Professor Oksana available online.
Problems. And it is my great pleasure and great honor to make this presentation on behalf of Oksana Drabkina. Esteemed colleagues and distinguished guests, it is a honor to take part in this important dialogue at the BRICS Women's Business Alliance Health Working Group session within the framework of this conference. In Russia, dear colleagues, and can I kindly ask you to give me permission to share my screen to demonstrate several slides shortly. In Russia, under the national project of active and long life, preventive health care, health literacy and corporate well-being are the key priorities for extending healthy life expectancy. Our experience shows a real progress in this area is only possible through the partnership between government, business and society. Like many other nations, Russia faces major challenges from non-communicable disease, which remain the leading cause of mortality and disability. The total economic burden is estimated by 4% of GDP, and only 13% its healthcare cost, and more than 80% are driven by the premature mortality and productivity losses. Reducing this burden is not a health goal, it is strategic economic investments in national development. At the same time, gender gap remains a major challenge. Russian men die on average 10 years earlier than women, primarily due to preventable risk factors such as smoking, alcohol consumption, insufficient physical activity. According to the studies of our centers, only one significant factor, risk factor for men's health and longevity is absence of marriage, especially the men aged of 50 are really sensitive to being married or not. This role of women as partners, caregivers, motivators in supporting men's health and promoting healthy lifestyles within families and workplace. Empowering women is in this role is therefore not only a social and cultural issue, but the evidence-based strategy to improve population economic losses linked to premature mortality. Reducing NCD is not only national task, but a shared global responsibility. Russian experience in prevention has become a foundation for international cooperation. Within the participation of experts from National Research Center for Therapy and Preventive Medicine in 12 national investment case for NCDs, which have been developed with World Health Organization in Kyrgyzstan, Kazakhstan, Uzbekistan, Russia, Botswana, Malaysia. We also conducted the investment case in mental health for several countries. This demonstrates Russian scientific can assess both economic returns of prevention. I have mentioned women's vital role in promoting health as leaders, caregivers, and motivators within families, places, and communities. That's why within the framework of the BRICS Women's Business Alliance, we have launched the BRICS Health Umbrella Initiative, platform designed to strengthen cooperation among women in health across BRICS countries. This initiative aims to unite women professionals and experts working in healthcare, public health, and health-related industries. It focuses on sharing best practices, supporting joint projects in disease prevention and health promotion, and encouraging cross-sector collaboration between business, science, and civil society. The BRICS Health Umbrella Initiative brings together 5 key areas of work: measuring and improving health literacy, strengthening health care system, promoting workplace health and corporate well-being, creating healthy and supportive environments, and developing NCDs investment case to demonstrate the economic value of prevention. Through these joint efforts, we aim to empower women as change makers, help businesses implement effective health solutions, and contribute to a healthier and more sustainable future for all BRICS nations. Today, I would like to focus on the just one dimension of the BRICS Health Umbrella Initiative, corporate health, and crucial role of business in supporting women who promote healthy lifestyles. Health is not a medical, but also a behavioral and social construct. To form it, 3 components are essential. Knowledge, people must understand what includes their health. Motivation, awareness should lead to the action. Conditions, infrastructure, and policies must make healthy choice accessible. Workplaces bring all 3 together. They educate, motivate, and create real opportunities for healthy behavior. That's why business engagement, and particularly the empowerment of women within the corporate settings, has become one of the most powerful drivers for public health today. The workplace is where most adults spend their lives, and where both health risks and opportunities concentrate. Yet one major hidden problem remains: presenteeism, which employers work while unwell, leading to reduced productivity. According to nationwide study by our center, presenteeism costs millions of rubles annually. Those with high levels of presenteeism lose 4.5 hours of working day, compared with just 30 minutes among healthier colleagues. To address this, we developed a scientific evaluation methodology integrated to the online tool Atria. It allows companies to measure productivity loss, identify risk factors, and design targeted wellness programs. The results prove that investments in health not only fulfill social responsibility, it brings a real economic returns. Indeed, investment in employers' health is not a cost, it's a profitable investment. In Russia, losses due to NCD equal to 4% of GDP, while smoking alone costs 440 billion rubles annually. Companies implementing wellness program achieve a return of investment of 3 to 5 times, in the best cases of 9. Every rupees investment in the health returns multiple benefits through higher productivity and lower losses. Corporate health promotion is therefore a strategic driver of economic growth and workplace sustainability. A practical example comes from Orenburg Gazprom company. After launching a wellness program, the share of the employees eating vegetables several times per day grew from 6 to 24%, and frequent fruit consumption also rose from 5 to 78%. The share of those adding extra salt also significantly decreased. However, physical activity levels did not improve significantly, showing that long-term change requires systematic initiative and active support from top management. Still, this example confirms that even modest corporate health programs can improve habits, reduce NCDs risk, and enhance employer well-being and productivity. The health of any society begins with inclusion and leadership, and women play a pivotal role in both. A study in Brazil showed that greater female representation has associated with a significant decline in child mortality. This proves that women lead public health outcomes improve. But women can do much more, especially within the corporate setting. They demonstrate higher health awareness and often act as informal ambassadors, shaping healthy norms at work. Companies led by women are more likely to implement wellness and mental health programs, fostering empathy-based, supportive workplace cultures. Healthy behaviors adopted by women also extend to families and communities, multiplying the impact. Every dollar invested in the workplace wellness yields $2 to $4 in productivity gains, making not only good for people but smart economics. Therefore, I call on the business representative to support women-led initiatives health promotion. By empowering women, we strengthen our teams, our economies, and our societies. The National Medical Research Center for Therapy and Preventive Medicine stands ready to share our expertise and cooperate with partners across BRICS to advance this agenda together. We call on everyone to join the BRICS initiative. Let's work together for better health and sustainable future. Dear colleagues, thank you for your attention and for opportunity to have this talk today.
Thank you. Thank you so much. We now move on to Dr. Sayantini Pramanik, product lead and co-founder, Pragmatic Healthcare Solutions Private Limited, India chapter. Ma'am, India is we've talked about it, among the top 3 countries globally with respect to cancer disease burden. Women bear about 51% of the total disease burden. Cervical cancer has been among the top 2 cancers in women in the country. And the country has a total reported incidence of about 125 to 150,000, with mortality being almost 75,000, which means that we're almost having a 50% plus kind of a mortality to incidence ratio. And for a 5-year survival rate also being a meager 51.787% based on a Lancet study. Although the incidence of cervical cancer is reducing, that's what the data says based on the initiatives which have been taken so far by the government. But it's still very, I would say, a dismal state when it comes to the mortality rates. And also the data highlights that in rural areas, the burden of the disease is significantly higher compared to the urban areas. A lot of efforts have been made in terms of bringing early intervention cervical cancer screening is a part of the NPCDCS program. But we all know that while the numbers may be increasing, the penetration level of screening is still 5%. And possibly there are a lot of grassroots level challenges with respect to women coming forward, the social taboo, as well as the effectiveness and the accuracy of the current methods which are used for screening. A couple of key questions which we have, Pam, for you. And what are some of the innovations which you are seeing in this particular space of screening? And how are some of these innovations addressing some of the key challenges of affordability, scalability, and also most importantly, inclusivity?
Right. Thanks so much, Shumai, for that question. And at the outset, I would like to thank Fiki Heel for giving us this platform. As you rightly said and highlighted the mortality rates due to cervical cancer, just to put things into perspective, um, it's one woman being lost to cervical cancer every 8 minutes. That's the stats in India. And since morning, we have been hearing about NCDs and the way forward to tackle them. And I think this is one thing that we all can consensus upon is the way forward is healthcare and not sick care. Right now, what is happening is women are not getting screened. Women are thus getting detected with cervical cancer at a much later stage, and thus resulting in a lot of burden on the tertiary and the quaternary care, which is nothing but, in short, a sick care. It's not just tormenting for the person who is suffering from cancer, but it's also a huge burden on the entire family, let alone be the other stuff. Now, in a country such as ours, preventive screening is the way forward again, because that is when we want to catch things early on, when uh, a primary care can be enough, a secondary care can be enough to take care of things and not let things um, roll down and develop or amount into cancer eventually. uh, in that point or on that light, um, cervical cancer screening is something that has been taken up by a lot of companies, um, starting from developing point of care PCR tests, HPV PCR tests, or maybe lateral flow kits, or portable colposcopes. There are several innovations that are happening, and these innovations, the main crux of these innovations are to take to be able to be to enable these innovations to be taken to the grassroots level and reach the last mile. But in spite of all these methods, the kind of impact that should be seen is not really coming up. And the main reason for this is the actual process of screening, which is pelvic examination. The women in this room would probably relate to this. The process of pelvic examination is something that is very unpleasant. No healthy woman would ever want to undergo a pelvic examination. And preventive screening is to be taken by healthy individuals. So there are about 207 million healthy women falling in the eligibility criteria or eligibility bracket right now in India across rural and urban areas. What we thought at Pragmatech is to innovate something that actually ensures that the dignity of the woman is preserved. And yet, the innovation should be scalable, not just at an urban level, but also at a rural level. And that's how we came up with ServiCheck. If I can have the slides moved. This is a product that, so I'm going to specifically talk about product also, because this is something that has been now commercialized in India. It's there in the market since late last year. And we are very proud to always say this, that there is something similar or a counterpart of this that is there in US. But yeah, they did identify the need of having something that preserves a woman's dignity, but it came out into the market after India. Generally, all the innovations happen in the Western countries and thereafter in Indian settings. But here the situation is quite reversed. And as you can see over here, this entirely decentralizes the process of screening, because this kit has been developed and validated, and it has been approved by the CDSCO for an at-home sampling. That is, a woman can carry it at home and do the sampling and get her test results, maybe on her mobile, or maybe as a test report in the rural settings. So this entirely takes care of the part that a woman doesn't want to come for a pelvic screening. For example, in rural areas, whenever a mass screening camp is put up, a woman for a woman, getting screened is not her priority. She might come, but when she has to stand in the queue for her turn to come, she prefers running back home because she has to cook a meal, or maybe because her child is going to come back from school and she has to be home. So these are the reasons why they turn up to the mass screening camps, but yet are not able to undergo the screening process. So something like this, which is a take-home solution, a woman can take it home, sample, and on the next day, maybe at a designated spot, at a designated time, she can just drop off the sample. Now, this is something that I'm talking out of our experience of rolling out in India. We have already rolled it out in the rural areas of Chennai, where this model has been adopted, and we have got fantastic results in terms of a huge number of participation, and the testimonials that we have collected from the women goes on further to say that uh, this innovation is not just taking care of the dignity or of or the perspectives of a woman that hinders her from taking up a screening, but also is something which is absolutely scalable at a national level. So I mean, now that immunization or HPV vaccination is being um, or is going to soon be a part of the national immunization scheme, screening also has to go hand in hand. So just imagine, for government, it would be such a difficult task to deploy a process wherein 207 million women have to be screened. How exactly would they be reaching door to door? So this is a solution that can be absolutely fitted in that kind of a scenario. And yeah, we are ready for the future, wherein we see that the cervical cancer screening would be rolled out soon, and uh, women would not have to step out of their home or stand in a queue or sit in a gynex clinic for her turn to come or undergo any embarrassing processes or questions, and just get her result from the privacy and convenience of her home. Yeah.
Thank you, Dr. Sayanthini. I think significant innovation and will possibly make a good dent when it comes to screening for cervical cancers going forward. We now come to Dr. Mona Daudi, Chief Executive Officer, Navago Star Iran Chapter, member of the BRICS Inclusive Economy Working Group, Iranian Chapter, Secretary of the Health Working Group, Iranian Women Entrepreneurs Association. Ma'am, health is the foundation of development, and preventing infections is one of the most effective ways to reduce the burden of NCDs. Iran is also facing the challenge of NCDs, with almost 83.5% of deaths and 78% of the burden of disease being attributed to NCDs. And also, interestingly, a secondary analysis of the 2011 WHO NCD risk factor surveillance survey carried out in Iran highlights that the overall mean risk score towards NCDs for women was significantly higher at about 41.75 compared to men at 36. The key reasons for gender disparity in risk score was attributed to variations in age, education, work status, etc. And also, aging was associated with a lot more of comorbidities, specifically in women compared to men. So, ma'am, some of the key questions for you are, in terms of NCDs, again, what are some of those interventions which have really made good impact when it comes to Iran, or any other learnings from any other countries? And how could some of these interventions be taken forward to the other BRICS nations? Over to you, ma'am.
Dear friends and colleagues, it's a true honor for me to be here as an invited speaker on behalf of Women Entrepreneur Trade Union of BRICS. About your question, women in healthcare sector face problems such as gender disparities, economic participation, social engagement compared to men. Small steps in hand hygiene monitoring can really help them to act. We think firstly of their physical and then their mental well-being better. About our project that is implemented at Razavi Hospital in Iran. Do you hear me? Ma'am?
Ma'am, there is a little bit of disturbance. We can, maybe you can speak again.
Yeah, I'm hearing. It has linked measurable improvement in hand hygiene compliance and infection reduction. The staff are women, and the system has been particularly effective in protecting them from hospital-acquired infection. The outcome include fewer sick leaves, better retention of female staff, and stronger participation of women in the healthcare workforce. This experience demonstrates that targets innovative health technologies can reduce both infection rate and gender disparities in health. The model is cost-effective, scalable, and adaptable, making it suitable for implementing across the BRICS countries, especially in facilities where women make up a large share of workforce. May I have time for the presentation?
Yes, please go ahead, ma'am.
Okay, thank you. May I have my presentation file, please? Would it be possible? I need to have my presentation file, please.
The presentation is to be shared.
I couldn't see it. Yeah, thank you. Okay, is it the first? May I share it? May I share?
Ma'am, do you want us to move ahead in the slides? Do you want to move to the next page?
No, I want to. Okay, I want to share the presentation with my laptop because it is not the first presentation. It is not the first screen.
Do we have sharing rights for the? Yes, ma'am, you can present. You can share.
Okay, thank you. Wait, please. I'm going to share. Okay. Okay. Non-communicable disease like diabetes, hypertension, and cancer are among the greatest challenges facing our health system today. They not only put pressure on national economies, but also undermine the quality of life for millions of people. In this context, the question of equity becomes absolutely critical. When we speak about equity in health, our minds often go straight to patients. But equity is not only about patients, it also concerns healthcare workers, most of whom in many countries are women. They too deserve safety, protection, and equal opportunities. the reality is that women make up the backbone of frontline care. They are present in crowded hospital wards, in intensive care units, working side by side with the most vulnerable patients. If their health and safety are not ensured, patients are put at risk, and women themselves lose the chance to grow, to contribute, and to take an equal role in society. Healthcare Association
Ma'am, we are unable to hear you.
Could you please repeat again?
Ma'am, you're not audible.
You couldn't hear me?
Yeah, now we can hear you. I think last few seconds we were not able to hear you. Please go ahead.
Can I continue?
Yes, please.
Okay. One of the biggest challenges in healthcare worldwide is healthcare-associated infection HAAs. These infections affect between 7 and 10% of hospitalized patients. And each year, millions of lives are lost as a result. The hands of healthcare workers are among the main channel of transmission. This is why the World Health Organization emphasized that hand hygiene is the single most effective way to prevent hospital infections. But HAAs are not only a threat to patients, they are also a threat to frontline staff, most of whom are women. When healthcare workers are exposed, workplace equity itself is compromised. Proper hand hygiene protects both patients and staff and reduces gender-based inequalities in clinical environment. An experience from Iran. Allow me to share an experience from my country, Iran. At Rezavi Hospital in Mashhad, under the leadership of CEO Dr. Mohsen Mehbar and with the scientific guidance of Professor Alami, a pediatric infectious disease specialist at Mashhad University of Medical Sciences, we carried out a project that was the first of its kind in a country, smart monitoring of hand hygiene in the ICU. I am proud to mention that this hospital recently received international recognition, winning the top award for hand hygiene innovation at the EPIC Congress in Geneva in September 2025. Rezavi Hospital, with 390 active beds and expanding to 500, has been a pioneer in infection prevention for over 12 years through its infection control committee. Our goal was simple: transparency, accountability, and equity in hand hygiene compliance. And we turned to technology to make this possible. The project has three components: a central monitoring platform, around 50 RFID tags for staff and a section ICU, and 6 smart dispensers installed at patient bedside. If the staff member registered their basic information such as role, age, even hand size, based on that, the system defined an individual standard for sanitizer use. Whenever someone approached dispenser, RFID and sensors recorded the data in real time and displayed it on a dashboard. Supervisors could track daily and monthly compliance, while supply levels were automatically monitored. In simple terms, we introduced the Internet of Things into infection control in an Iranian hospital. First, all staff, regardless of position, were held to the same standard that created fairness in performance. Second, all ICU patients, whether male or female, rich or poor, received the same level of protection against infection that created fairness in care. And third, because most healthcare workers are women, this innovation gave them greater safety and peace of mind that created fairness in opportunity. When women doctors and nurses can work without fear of infection, they can perform with greater confidence, seize equal opportunities for growth, and thrive alongside their male colleagues. Challenges and next steps. Of course, the journey was not without challenges. Some staff preferred to use manual buttons. The system could only report sanitizer use within 1 meter. And in the first version, it could not distinguish if hands were disinfected before or after patient contact. So we are now upgrading the system to capture both. And when several people were at the same bedside, error occurred. These are not failures. They are part of the learning curve because innovation is not only about technology, it's also about culture, training, and social acceptance. Collaboration for safer staff. To further support healthcare workers, especially women on the front line, we strengthened collaboration between Iranian universities and the SPCI HUG unit center in Switzerland, with one central goal to improve hand hygiene and infection control in hospitals. This collaboration has included filling out the WHO HHSAF questionnaire by participating hospitals, supporting the staff to improve hand hygiene and infection control programs with tools and guidance, running train the trainer course to spread hand hygiene standards more effectively. The results are clear. Patients are better protected, staff face less occupational risk, and the health system itself becomes more equitable and resilient. Conclusion. The Razadi Hospital project taught us a simple but powerful lesson. Even in resource-limited setting, it is possible to design systems that bring greater transparency, accountability, and fairness into healthcare. If we truly want to fight non-communicable disease, medicine and equipment alone are not enough. We need systems that are, show the clip. We need systems that are fair, inclusive, and sustainable. And this is exactly where innovation plays its most important role, not for the sake of technology itself, but to make sure that every patient and every healthcare workers everywhere receive the same level of safety and care. Now the chef can see there design hospital smart manufacturing projects.
Thank you, Dr. Mona. We now move on to the last panelist of the day, Dr. Natalie Liao, General Manager, Infinity Institute of Intelligent Technologies, China chapter. Um, Ma'am, again, I think we again are on the topic of oncology, and we're all aware that China is leading in Asia in terms of the cancer disease burden. Almost 4.8 million new cancer cases being identified, and also important to note that blood cancers and the incidence of that is significantly increasing in China, with the total incidence being almost 200 or 1,000 patients, with a 60% mortality to incidence ratio. Aging, smoking habits, obesity, exposure to pollutants, all of them are risk factors. There are new technologies today for blood cancer treatment like CAR T cell therapy, but there should be a lot more concerted effort to address some of these disease areas. So, two quick key questions to you, ma'am. What are some of the new technology trends, specifically leveraging AI and digital health, which have created a meaningful impact on outcomes of blood cancer treatment? And again, can some of these innovations be scaled up and made more available among the BRICS nations? Over to you, Doctor.
Thank you. Hello, everyone. Nice to meet you online. And here is Dr. Natalie Liao from China. Before I founded the institute, the Infinity Institute for Intelligent Technology, I have been working many years for the Technology Office of the Department of Health, UK. So after I relocated back to China, I have been collaborating with a number of public hospitals, specifically in terms of the adoption of big data and artificial intelligence. So today, to take this invaluable opportunity, I'd like to showcase a project IIT have been collaborating with one of the hospitals in southwest China. So for the next few minutes, I will share my screen and walk through how we apply the large language modeling technology to increase the innovation of blood cancer treatment in China. So just to check, everyone can see my shared screen? Okay?
Yes, Doctor.
Okay, so blood cancer, which include like the leukemia, lymphoma, and multiple myeloma, account for a modest yet significant disease burden in China. Based on 2024 data, so we can see that the leukemia shows an incidence of about 6.7 per 100,000, ranking around 10th overall, with like 2.6 to 3.1 of total new cases and death in both sexes. And non-Hodgkin lymphoma contributes about 2.6 to 3.0% of cases. Multiple myeloma shows clear regional variation with higher incidence and mortality in northern and eastern provinces in China. So as you can see, besides the inequity for gender, there are much more inequity for different districts due to the socio-economic factors. So in May this year, IIT co-launched a large language model initiative called Dr. Lin Jin. The Chinese character means magic mirror, which the first of its kind in China, together with affiliate cancer hospital of Chongqing University in southwest China. IIT has also launched an intelligent diagnosis system for hematological disease based on Lin Jin model. The system compasses 3 subsystems. The first is an AI-driven diagnostic system for integrated MICM reporting, which is based on the WHO standards. The second is a patient management software, which allows self-reporting and wearable devices data to be linked with the EMR system in hospital with assistance from the social worker group. And the third subsystem is a cloud-based telemedicine platform, which enable the different institutes within a medical consortium to manage the online, to manage the sampling delivery and online diagnosis remotely. And this slide shows the architecture of the Lin Jin model, an AI-driven system, which contains 3 key components. The deep learning model, which is a transformer-based large model trained on millions of heterology datasets for intelligent pattern recognition. The multi-omics database include integrating genomic, transcriptomic, and proteomic data to support molecular level analysis. And the knowledge graph means linking disease, genes, and drugs to enhance clinical reasoning and decision supporting. Together, they form a comprehensive framework for precision diagnosis and research in blood cancers. These slides introduce the domain expert knowledge graph of the Lin Jin model. It integrates over 10,000 medical articles, 100 classic hematological oncology textbooks, and over 10,000 blood cancer image cases, combining literature, guideline, the image data to support accurate diagnosis and knowledge reasoning. And the Lin Jin AI Doctor, which provides many innovative solutions compared to the more traditional ways of treatment. So, for example, it has intelligent voice interaction functionality, which allows natural language access to patient data with fast response and high accuracy. And the precision diagnosis means it views multimodality data through CNN, which is the algorithm, and knowledge graph algorithm as well, to generate the WHO-aligned 4-dimension diagnostic reports, which I mentioned earlier, which is the MICM framework. And the treatment decision-making can integrate clinical guidelines and real-time lab data to produce personalized drug and dosage recommendation. So based on the last 10 years data sets from the medical consortium we've been working with. And lastly, the prognostic evaluation demonstrates, and for the both 3-year and 5-year survival rates, that's been increased, and the recurrence risk based on IGCC models is decreased. Together, these modules enable end-to-end intelligent diagnosis, treatment, and prognosis in blood cancer. So in conclusion, when we reflect how the AI technology help innovate the treatment, the pathway, and the patient care and efficiency in China, so mainly it tackles 3 industrial pain points. So the first is low efficiency. So the traditional way, for example, the MICM reporting, we need different doctor with different knowledge, expertise to give individual conclusion, and then only very senior and experienced clinician can have the integrated view and put the final decision. So with the supports from our AI solution, and it can automatically give integrated reporting from 4 different forces reports. And secondly, as I mentioned earlier, the inequity between different regions are huge in China. So if we can use the AI technology combined with the telemedicine, it allows the people from the more remote area, the rural area, to have their tests locally, but still can get the very experienced clinician level diagnosis online. And thirdly, so like the blood cancer diagnosis, it's complex and it's a lack of standardization, and not many clinicians are trained at the level can do the precision diagnosis and treatment. So hopefully, for our next steps, we will roll out our AI model and the telemedicine to wider areas to not only improve the treatment of the patients, as well as train the doctors in less developed areas in China. So this is the very last slide. And I think AI is a wonderful example of how technology being used in healthcare. And hopefully this experience in China can just invoke some thoughts for other panelists and audience in BRICS countries. Thank you very much.
Thank you. Thank you, Dr. Natalie, for the insightful discussion on AI in blood cancer. So I think that brings us to the close of the session. We've had the chance to discuss with all the panelists. I think very, very interesting and diverse set of ideas ranging from mental health related initiatives at Brazil's corporate sector, Russia specifically talking about the three-pronged approach towards health around knowledge, motivation, and conditions, and how corporate health programs are able to drive simple yet meaningful interventions in terms of changes in behavior, whether it's fruit and vegetable intake or increasing physical activity. The last mile community networks to drive impact on NCD management in Indonesia, the hand hygiene program in Iran, and of course the entire program around preventive screening, which is demonstrated by the survey check innovation which has happened in the Indian context, and the AI model, Dr. Linjin AI, driving a lot of significant change when it comes to blood cancer treatment in China. I think a diverse set of ideas addressing different kinds of NCDs, but also addressing the resource constraints, the gender related variations, the geography related variations in their respective countries. Important, I think, going forward will be to continue these deliberations such that we could exchange the learnings and integrate some of these new innovations into the policy framework for NCD management across the BRICS nations. And I think with that, we come to an end of the session. But I'd just like to end with a famous quote by Henry Ford, that coming together is a beginning, keeping together is progressing, and working together is success. So hope for the success in future as we work together on this entire agenda of NCD management in the BRICS nations. Thank you. Thank you, everyone, for joining in for today's session.
Okay, I have a short announcement for all of you. We have a cab service available outside FICCI Federation House. In case if you want to be a part of the FICCI Awards, that's going to be scheduled at ITC Moria. So